In the last episode, we talked about why you can be doing what seems like all the right things and still feel stuck. Today, let's go deeper into one of the biggest missing pieces. When people talk about healing, they often talk about the mind or the emotions or the nervous system, or it's all about inflammation, or it's all about hormones or trauma or mindset. And all of these things are incredibly valid. But what if the missing link in your healing, in your resilience, your clarity, and your emotional capacity is not only psychological or biochemical, but structural? Think about it. Even if your conscious mind understands that you're safe, even if you've done a lot of emotional processing, even if you're doing all the nervous system tools, if the body is physically holding tension and signaling alarm to the brain, your brain is going to listen. I'm Dr. Satya Sardonicus. I'm the founder of the Neural Fascial Flow Method, and this channel is about the body-based missing link in healing, resilience, and human potential. Today we're talking about the physical doorway into that missing link. Let's start with fascia. Fascia is the connective tissue web of the body. If you've ever seen a cut of meat and noticed that tough, white, filmy material wrapping through it, that's fascia. But in the living body, fascia is not just wrapping. It's not just packaging. It's not just the stuff we stretch, release, or foam roll, even though there's a lot of kinds of therapies that just treat it as a physical thing. Fascia is actually a whole body communication network. It has every muscle, every nerve, every organ, every bone, holding them in relationship to one another. It's the scaffolding of the human body. We're taught in school that the skeleton is the support structure, and the muscles move the bones, and the fascia is just the stuff we kind of cut out of the way to see the real stuff in anatomy lab. But that's not actually accurate literally at all. If you see an x-ray and the bones are touching, that's a huge problem. Your bones are actually floating, suspended and enmeshed in the fascial web. This is a concept called tensegrity. It describes an architectural structure where the rigid pieces are not touching and they are connected by a continuous piece of elastic. The elastic is what maintains the shape, the tensional integrity of the structure. So if you press on it and you release, it comes back unharmed. My favorite rhetorical question to ask is this: do we really have 600 different muscles? Or do we have one muscle in 600 fascial pockets? It's actually both. But here's the most important part. Fascia is one of the richest sensory organs in the body. It has 6 to 10 times more sensory nerve endings, specifically proprioceptors, the safety signaling system, than muscle does. There's a statistic that says there are roughly 3 trillion bits of information per second passed over the nervous system. 3 trillion bits! And we are conscious of about 50 of them per second. Things like the temperature of the room, the brightness of the light, the sound of my voice. So, what's making up the rest of that information? It is your body talking to your brain and back and forth. It's the fascia constantly feeding the brain information about pressure, stretch, movement, and whether you are safe or under threat. And when that fascial web gets stuck, glued down, or braced for any reason, it creates massive problems. I know this not just as a doctor, but as a patient who lived inside of a deeply traumatized nervous system and body for a very long time. When I was 7 years old, I was in a car accident. I was in the middle seat of a pickup truck, so I just had a lap seatbelt. And we were rear-ended at 35, 45, 50 miles an hour. I don't know. I was a little kid. But we were in a stopped car. And I ended up with 3 disc herniations in my neck and one in my low back from the full body whiplash. My dad is an amazing chiropractor. My mom is a talented craniosacral therapist. So I had wonderful care. But what they didn't realize, and no one would for nearly 20 years, was that I also suffered a life-changing brain injury that day as well. As I got older, I started developing mysterious, progressively worsening neurological symptoms. I started falling when I was 16, having what are called drop attacks. It's kind of like passing out, but you don't lose consciousness. all of my muscles would just turn to mush and I would drop to the floor like a sack of potatoes. By the time I was in my early 20s, I was collapsing 20, 30, sometimes 40 times in a day. I had chronic 24-hour-a-day headaches, dizziness, nausea, one-sided muscle weakness. I had to wear earplugs 24 hours a day because even a whisper would trigger my nervous system into so much alarm, my heart rate would just skyrocket and drop down, and I'd almost pass out. If you asked me to rate my pain on a scale of 1 to 10, I regularly reported it at 25. It was inhuman. My doctors, my parents, and I all thought I was dying. They thought maybe I had multiple sclerosis or schizophrenia because of the hallucinations I was having, or functional neurological disorder, or my personal favorite, that it was all in my head. Turns out it was not all in my head. That was literally the problem. My brain was falling out of my head. When I was 26, I finally had an upright MRI. So most MRIs are done laying down, and gravity changes the position of the brain, so this condition gets missed all the time. The upright MRI showed that the lower part of my brain, the cerebellar tonsils, had herniated out through the hole in the base of my skull down into my neck. This condition is called cerebellar tonsillar ectopia, or CTE. If it herniates more than 5 millimeters, then it gets called Chiari malformation, which you may have heard of more oftenly talked about as a birth defect. But any amount of herniation means that a hole that should only have one thing, your brainstem, now has two things, brainstem and brain, and it compresses both of those structures. It interferes with the cerebral spinal fluid from flowing properly, and it traps the brain in a state of absolute panic. And here's the crazy part. This is not just some rare condition that happened to me. A study in 2010 looked at 1,200 people with neck pain. They found that in people who had never had a head injury or whiplash, 1 in 20 people with neck pain had some degree of brain herniation. Are you kidding me? And if you have a history of whiplash or a concussion, it goes up to 1 in 4. You likely know people with this condition, whether they know it or not. It constantly gets misdiagnosed as fibromyalgia, chronic fatigue, POTS, and sensory processing disorders. When I was finally diagnosed correctly, the solutions presented to me were surgical. They wanted to cut off the back of my skull to decompress the area, or do the what's called Barcelona procedure, where they surgically cut the filum terminale, the fascial attachment between the spinal cord and the tailbone, so my spinal cord would just dangle to release the pressure. I looked at the outcomes for those surgeries, and they were not good. They might help a little bit, but then they would get worse later. So I asked myself, okay, well, how can I accomplish what these surgeries are trying to do mechanically, but do it non-invasively without all of those negative side effects? That question led me to map out a structure that I've coined the Dural Fascial Kinetic Chain, or the DFKC. This is a continuous matrix of living tissue that originates with the dura mater, which literally translates to tough mother. It's this very tough, specialized fascia, kind of like fabric, that lines the inside of your skull to protect your brain, and then comes down like a protective sleeve around the spinal cord, attaches to the tailbone, but it doesn't stop there. From the tailbone, there are these dense fascial ligaments that connect to your sit bones. And then from there, this spiderweb material runs down the back of your legs, through your calves, and then all the way into the plantar fascia on the bottoms of your feet. It is one continuous interconnected pathway. Think about putting on stockings or pantyhose, right? If the stockings are bunched up at the calves or stuck at your ankles, and you try to pull them up from the waistband, what happens? It's not going to work very well. You might even put a hole in them. You have to start down by the ankles and feed the length upward. If you pull on the corner of a bed sheet or any fabric, the tension doesn't stay in that corner, right? It distorts the entire fabric. So because the body is connected like a continuous piece of fabric, that's what fascia acts like, if the fascia in your calves gets gluey and stuck, or the fascia in between the bones of your feet gets rigid, you end up with this tangle of fabric at the bottom of the chain, and when you stand up and walk around, that tension yanks up through the back of your legs, pulls on your tailbone, and puts physical tension on your spinal cord and the lining of your skull. I didn't let them do the surgery. Instead, using myself as a guinea pig, I started feeding the length of the fascia up from my feet and my legs, taking the mechanical tension off my spinal cord from the bottom up. I went from collapsing 40 times a day to once every couple of weeks within 3 months. But you do not need to have a brain herniation to have tension in this chain. If you sit at a computer all day, if you have forward head posture, if you've ever had a whiplash injury, or if your body is just trying to protect you from the chronic stress of modern life, your DFKC is likely holding massive amounts of tension. And this tension changes literally everything. Normally, when you move your body, your joints and soft tissues send proprioceptive feedback to the brain. Proprioception is the brain's built-in mechanism to get ready for stress and recover from stress or an alarm trigger. If you smash your finger in a door, what do you instinctively want to do? You shake it, you squeeze it, because movement and deep pressure both send safety signals that literally race ahead of the alarm signals to turn down the fire alarm. But when your DFKC is locked under high tension and you have stuck places anywhere in your fascia, the brain is now starving for proprioception. It's not getting the safety signals it expects just from normal movement in your day. So, adding insult to injury, though, those stuck gluey places are sending nociceptive signals, alarm signals to the brain 24 hours a day, telling it, help, I'm stuck. So even if you have a perfect diet, perfect relationships, nothing emotionally is stressing you out. Your body is continuously telling your brain that your life is in danger. When the brain perceives this chronic threat, it uses the fascia to protect you. It has a strong protective function. And one of the most common things it does is use the fascia to literally glue your ribs together, turning your ribcage into armor to protect your vital organs. But here's the catch. Your ribcage is supposed to articulate and expand when you breathe. So, if it's locked down like armor, your body has to recruit what should be accessory muscles in your neck to lift your entire chest just to inflate your lungs. And you end up with chronic, maybe agonizing neck tension. And you can go get a massage or a PT or a chiropractic adjustment every day of the week to loosen your neck. And an hour later, it's going to snap right back. Why? Because your brain is saying, no, I need those neck muscles to be tight. They are literally helping me breathe. This is a boomerang effect. You cannot force the body to let go of a protective splint if the foundation is still signaling threat. Healing needs to be like partner dancing, not dragging a toddler kicking and screaming. Most therapies, from deep tissue massage to chiropractic adjustments to the intense fascia release we're seeing all over the internet now, skip straight to trying to make a change happen. But if you yank the crutches away from a nervous system that is actively in alarm, it's going to identify that change as a threat and want to clamp down harder. This is the body-based missing link. Not just the fascia, not just the nervous system, not just movement, and not just mindset. The missing link is actually the relationship between them. How the body's structure signals the nervous system. How safety determines whether change can be received. How change only really holds when the system can integrate it. When we address the tension in the Dural Fascial Kinetic Chain, we stop starving the brain of safety signals, we stop the 24/7 alarm loop, and suddenly all of those other therapies, the nutrition, the meditation, the mindset work, the brain exercises, finally have fertile ground to land on. Your creativity expands, your decisions change, your leadership shifts, your life changes. So, yes, we can talk about fascia as anatomy, but fascia is also part of how you inhabit your life. It's part of how you absorb impact and conduct force through the system. It's part of how you sense. It's part of how you adapt and how you return to center. And when fascia becomes more fluid, when the body becomes more articulate, more responsive, more coherent, the human being often becomes more fluid too. And that's where healing becomes less like a battle or even a full-time job and more like a return to fluidity, a return to coherence, a return to the body's intelligence, a return to the self that was never actually gone, just buried under protection. In the next episode, we're going to talk about why nervous system work specifically doesn't always stick, and why even good therapies can create a boomerang effect if the body doesn't have the capacity to integrate that change. But for today, I want to leave you with this. Your body is constantly communicating with your brain. If we want the brain to feel safe, if we want it to prioritize healing and connection, we have to make sure that the structure is sending the right signals. If this resonates, subscribe so YouTube knows to show you future videos. And if you want a place to begin, I've linked the free fascia and nervous system guide below. I'm Dr. Satya, and this is Human Coherence. I'll see you in the next video.